come on up, if you don't mind.
So you're good?
Yeah.
Hi, everyone. I just checked the mic real quick. We're good. No issues on the line. And you folks are all ready to go? Okay. So I'm Steve Buick, the press secretary to the Minister of Health, Tyler Shandro. We're here to just do a quick announcement on changes in LPN scope of practice. We've got some names. With the minister is the council president for the CLPNA, the LPN's council. That's Valerie Pace. In the audience is the CEO of the council, Linda Stanger. They're both available to answer questions afterward. And from the department is Leanne Wagner. Leanne will pitch in as needed in the Q&A after as well. So I think we're ready to get going. I'll just ask Minister Shandro to start.
Great. Well, thank you for coming, everyone. And as Mr. Buick mentioned, with me today is Valerie Pace, the president of the council of the College of the Licensed Practical Nurses of Alberta, as well as Linda Stanger, the CEO of the college. We're here to announce some changes for LPNs, which will improve the care that Albertans receive. There are over 16,000 LPNs working in Alberta, and most of them work for Alberta Health Services in a range of settings, including hospitals, community health centers, continuing care facilities, urgent care centers, as well as home care. But historically, we've seen underused LPNs in Alberta. We've had too few of them, and their scope of practice has been too limited. Over the past decade, we've made huge progress in terms of supply. According to the latest national data, in the past decade, our LPN workforce grew by 85%, by far the fastest growth in the country. The result is that our supply per capita has almost caught up to the national average. And today, I'm pleased to announce that we're taking a big new step on another issue, their scope of practice. We're going to make amendments to the LPN's regulation under the Health Professions Act to allow LPNs to provide more patient care. So as of February 1st, 2020, they'll be able to first administer blood or blood products. They'll be able to dispense certain drugs based on a prescriber's instructions. They'll be able to provide an ultrasound for bedside nursing assessments. They'll be able to administer intravenous nutrition, and they'll be able to administer medication by an invasive procedure such as a central venous line. Now, they'll need to adhere to standards of practice being developed by the college right now and to follow their employer's policies. Right now, LPNs are trained to do many of the new activities already, but they can't do them because the regulation is outdated. In fact, it hasn't been amended since it came into force in 2003. This doesn't support the health system. It underuses a highly competent workforce and makes the system less efficient. So these amendments will better reflect what our health system needs here in Alberta and what LPNs are already competent to do. They're also in line with what is happening in other provinces and brings us into line with these other jurisdictions. The changes will make the system more efficient and increase the access to care that Albertans receive. Patients won't have to wait for another provider to perform these activities. And LPNs will find their work more satisfying, and in turn, the changes mean that registered nurses can spend more of their time doing what they're trained to do. Our government campaigned on strengthening the publicly funded healthcare system, and one key way of doing that is to expand health professionals' scope of practice to let them do what they're already trained to do. Our government is committed to working with health professionals to deliver on the commitment at the core of our platform, a stronger, publicly funded healthcare system in Alberta. And now I'll ask Valerie to say a few words.
Thank you, Minister Shandro, and all of you for being here today. Today is a great day for Albertans and the province of 16,000 LPNs. As the president of the College of Licensed Practical Nurses, I am delighted to be here for this important announcement. Thank you to the Minister Shandro and the Alberta government for amending the Licensed Practical Nurse Profession regulation, promoting full utilization of the education, the skill, and the ability of the LPN. These changes will have significant positive impact in our healthcare system. Expanding the LPN scope in the areas identified by the Minister will increase continuity of care, increase safety, and improve the overall patient experience. As valued members of the healthcare system, LPNs work alongside physicians, other nurses, and healthcare providers. This scope expansion enhances the LPN contribution to any team on which we work. And finally, the amendments bring clarity to the scope of practice and the LPN and the opportunity for the profession to continue to evolve within a rapidly changing healthcare system. Today, we celebrate the significant achievement. Tomorrow, we continue the work of finalizing standards of practice that guide the profession and support the expanding role. While we prepare for a smooth implementation of the regulations in February 2020, the college's new and rigorous standards of practice will set out expected behaviors and any requirements that all LPNs must meet before performing these health services. Through these standards, the college can assure Albertans that LPNs provide quality, safe nursing care. We applaud the vision of the government and extend our sincere appreciation to the team at Alberta Health, who work very closely with CLPNA to make this happen. Licensed practical nurses are up to the challenge and look forward to the opportunity this amended regulation provides. CLPNA's commitment to Albertans is to ensure you continue to receive safe, competent care by licensed practical nurses. Thank you.
Thank you, Valerie. Questions, and just a reminder, I think we may have callers on the line, so we'll start with the room. Questions?
For you, Minister, or for Valerie. So this is already being done in a lot of other provinces then. Are we breaking any ground here in terms of responsibilities for LPNs? Are we just catching up then, basically?
Later, my CEO will receive answers to the question then, probably.
Scope varies. I'm sorry.
Do you want to come up?
They're going to want you up there.
Thank you. Scope varies somewhat across the country, but we had actually lagged behind. What I believe at this point is that we'll be with several that are administering medications invasively, but the rest will bring us in line with what is happening. And when our scope was originally approved in 2003, we were leaders of the pack in this country. So this is bringing us back up.
And you're basically doing a lot of orthopedic stuff at that time, broken bones and that sort of thing, right?
We have a specialty. We have a specialty in orthopedics, yes.
But I guess my question is, what on a day-to-day basis were they doing before these came in? What were they doing? What kind of procedures were they performing?
Well, nursing is a pretty broad scope, so they provide care for patients. All kinds of care. They do nursing assessments, they provide treatments, they provide care with families, support to physicians and members of the team.
Minister, you're saying that, sorry.
Well, and maybe to add to that, I mean, just to use a personal anecdote as an example. So my dad was just in a hospital, and he was receiving amazing care. But when he needed a central intravenous line, into the bicep, into his heart, there needed to be a transition of care for that one time. And so what we're trying to do is try to be aligned with what LPNs are trained to do and what other provinces are doing, so that we can be more efficient, have fewer transitions in care.
I know that you wanted to do this to reflect current health system needs. I think you said before you were trying to get more LPNs, or to get more specialists to remote
To do what they're trained to do
areas.
already, yeah.
This is the way to do it then.
Yeah.
Who's doing these things now? Like all these 5 things that are listed?
Registered nurses right now. So there'd be a transition to a registered nurse from the LPN in that care. So that our goal through this is to have fewer transitions in care and to make sure that the LPNs who are already working in, whether it's a hospital setting, urgent care, community care, or a continuing care facility, that there are fewer transitions, that those LPNs are enabled to do what they're already trained to do.
Can you give a brief explanation, or can one of you, the difference between a registered nurse and an LPN?
So I speak for the College of Licensed Practical Nurses and am more familiar with that. But registered nurses graduate from a 4-year degree program. Licensed practical nurses graduate from a 2-year diploma program.
Now, I imagine there's going to be some change in demand for education here. Has there been any working with post-secondaries as to how that's going to be handled?
Well, as I said, we have 16,000 licensed practical nurses in Alberta. We obviously do want to see those numbers increase. I'm happy to maybe defer that question to Assistant Deputy Minister Wagner, to talk about what we're doing as a ministry to be able to work with advanced education on that. If you don't mind, Assistant Deputy Minister, or you want to come up and, oh, sure, yeah, come on up. Yeah, is that right? Or do you want that answer now? Okay, come on up.
So the supply we have now will meet our needs now and into the future. We don't, at this point, we don't think we need to add any new spaces to the LPN colleges because there's enough supply both within Alberta and in Alberta, and there's across Canada, plus enough capacity. Of course, we monitor that very closely and ensure that we can, if we see that we're not graduating enough students to meet the demand from the healthcare system, we work with our partners at Advanced Ed to see if we can open up those spaces into the colleges.
Valerie, how are you paid right now? Is it a set fee, or is it a grid, or how are LPNs paid? It's not a, yeah, sorry, go ahead.
You are paid by the hours. So you start out at a set thing, and when you accumulate hours, your pay increases at that time.
So you're not, can you tell me what the average is?
Not right off hand, I can't.
Oh, sorry. Assistant Deputy Minister Wagner.
Maybe just stay out there.
We just got to keep you up here.
We knew you were going to ask that question, so we came prepared. The average, the licensed practical nurses' salaries range from $26.45 an hour to $34.97 an hour. And they tend to make more if they have more advanced training, so such as renal dialysis. And if you want to compare it to our registered nurses in Alberta, in terms just of their hourly wage, make $36.60 an hour, and their top rate is $49.34 an hour.
That's a bargain, that's a bargain, that's a.
That is part of their collective agreement, yes.
Are you worried, Valerie, I mean, we've all been in jobs where they give us more responsibility but not extra pay. Are you getting any extra pay as your responsibilities increase? You'd be asking for it, I guess, too, or do you feel that might be something you'd want to ask for?
That's something I want to discuss. I regulate the profession, but not the wages.
Can you
That's a good point. I mean, yeah, because there is a separation between the college, which is how the profession self-regulates, and then the union as well.
Just want you to speak to that then.
Well, I guess after, I'm happy to have the union be asked that question in response to this. And what I would say is that what we're doing, though, is enabling a profession to be able to do what they're already trained to do, and making them in line with what other jurisdictions are already allowing them to do.
So is there anything on this list, it's all just regulatory, they're already trained to do all of these five?
That's right, yeah. I mean, there's also going to be, as a result of the change, so we have the Health Professions Act, and under the Health Professions Act, we have 29 professions, and each one of those professions is going to have their own regulation, which is going to enable them to self-regulate. So they can have a college then established under the regulation, and they can self-regulate under that. Then it's up to the colleges as well to work within the regulation to develop standards of practice for each one of those professions. And so this is just one of our 29 professions.
Can somebody elaborate in sort of layman's terms, these 5 new things? Administer blood or blood products, is that a needle? Like, is that a blood transfusion?
It's a blood transfusion,
That's a
largely.
transfusion. Okay, and then the next one, dispense certain drugs based on a prescriber's. So a doctor or a pharmacist would prescribe and you would basically give people the right number of pills? Is that what we're talking about?
Correct. Like if you were dispensing meds, like on a Saturday, you get the prescription, on Sunday the pharmacy's not open, we give them a short supply to get by till Monday. Or if a patient in the hospital goes on a pass, we would give them the medication to get them through.
So most of these are essentially more powerful LPNs to put needles in people that's gonna put something into their system. Is that, like, or
Well-
give them pills?
Dispensing of meds is not always needles, it could be an oral medication.
Not that one, but the
Oh.
other ones on this list, intravenous, administered medication by invasive procedures such as a central venous line, administer blood or blood products, we're talking about needles, right?
Yes.
Is there any rationale for, as you say, you're already trained to do this, so I guess the question is why weren't you before? Different jurisdictions allow different things. What's the rationale for that? Why not let everyone, why are they not allowed, everyone not allowed to do full scope of practice?
I think healthcare in general is dynamic. It's a dynamic area, and the scopes of practice for all 29 professions is always evolving. As I mentioned in my opening remarks, that this is something that's been in the works since 2003. It's unfortunate that it's taken this long for this one profession to have this update in their scope of practice. One of the reasons why I'm so excited to be able to announce this now. But I would say that all scopes of practice are always evolving. And there's some really good reasons why it does take some time for it to take time, because there are other professions that have to be engaged to be able to get their feedback whenever a scope of practice is updated. But I don't know if that answers your question.
Yeah, sometimes in these things, different groups can get very territorial. Is any of that, the fact that we haven't made a lot of progress, is it?
I don't see it as zero sum, and this is something that's been going on since 2003. So I don't see it as zero sum. I see it as an opportunity to enable a profession who's already been trained to do something, so that other professions who are working in these same facilities have more time to do what they're then trained to do. So, for example, the registered nurses can spend more time doing the types of care that they're trained to do. I don't see it as being zero sum at all.
Can I ask you a budget question? Your AHS review doesn't come in until December 31st, right?
That's correct.
Is that gonna make it difficult for you? Because this budget coming up is gonna set the landmarks for the next 4 years. But aren't you gonna be hampered by the fact that you don't have the review done on the AHS?
Well, I mean, we did receive an interim report from EY in September to be able to help us understand. It didn't include any numbers or anything like that, but no, I would say that how we're proceeding with this budget. It's going to be tabled on the 24th, and there's going to be another one in just a matter of months in the spring. So this is a matter of us going forward with what we do know. If the AHS review comes back and provides us with other information on how we can be more efficient, and how more resources can be directed to the front line. Like, for example, at some point this fall, I'm hoping to be able to announce what our plan is going to be for a surgical initiative, which is in our platform. So, I mean, that's going to be a significant amount of money for us to continue to spend in healthcare, a significant more amount of money for us to be able to do that. So getting a report from EY at the end of the year to tell us how we can be more efficient within AHS and Covenant and Alberta Health, so that we can make sure that money is going towards our front line for a surgical initiative, for example, or other things we're going to be doing. It's just a matter of us being able to say to Albertans what our priorities are in healthcare.
Did you say you already had a preliminary report from EY?
There was a preliminary report that we spoke to them to be able to get an understanding before budget.
Not numbers, but some
No
strategic
numbers.
direction already or suggestions.
I don't even know if it had included strategic direction, but it allowed us to understand that we felt comfortable going forward with our budget this October, and knowing that anything that they're able to advise us on in December is just going to be able to be more efficiency, so we can have that other ability to be directing to our priorities in the healthcare system.
Any chance you'd share some of this feedback?
Well, that in September? No, I mean, it was really high
Give
level.
you a sense of what we might see from healthcare in the budget. I guess it's my budget.
Gotta wait till the 24th, Dean.
Well, sorry, one more question for Valerie and Linda.
Yeah.
I'm trying to get a sense of, again, like, what needles right now LPNs can give compared to RNs. Like, if I go in for, say, a blood sample or to give blood, is that an LPN or an RN taking that blood?
That could be either.
Okay, so right now, LPNs are doing a lot of needles, like you could get stuck with a needle by an LPN or an RN, but basically they'll be able to do more of that kind of thing.
What'll happen is, right now they can initiate.
Up to the mic if you don't mind.
I'm sorry. What will happen right now, they can initiate an intravenous. What the difference will be when they can actually hook up the bag of blood to the intravenous to the patient. So they'll be able to provide that whole service, rather than create a break in care and go and get someone else to come back and do that.
And was the UNA consulted on this at all?
Yeah, I mean, that was my understanding. I was advised by Assistant Deputy Minister that they were, that they're included in the engagements that have gone on since 2003. I mean, this has been a significant amount of consultation over the last 15 years.
There's no concern from them or from other stakeholders about LPNs, with no offense intended, of course, with a 2-year diploma, doing some of the work that these people with a 4-year degree have been doing?
I think health professions in general understand that this isn't zero sum, that this is about enabling professions to being able to do what they're already trained to do, so that other members of other professions then can focus on what they're trained to do.
Valerie, once these come in, can you just give me a broad idea? Are LPNs now able to practice to the, Valerie, to the full scope of practice? How close are they now to practicing the full scope of practice in Alberta once these are in?
They will be practicing the full scope of practice once we get,
There's no more place to go. This is it. They're now fully scoped, so to speak.
there's always room to grow. So as of this point, there will be full scope of practice for what we have.
They're always evolving.
Yeah.
They're always evolving. I think all 29 professions, their scopes of practice are always going to be evolving, and there's always going to be a need for us to always having the regulations of all the professions.
There's a better way to phrase it. Are
Yeah,
we
is
up
there-
to par with other jurisdictions in, or LPNs say another province doing far more still then?
Well, I guess if there's a question about jurisdictional scan, I suppose that's for assistant deputy minister, but, yeah, is it right to get back to you on that one? Okay.
So is there anything in the current training that's not included here?
Well, I think what we did over the last 15 years is make sure that, we took the request from the college of the LPNs, because they came to us and said, look, this is what we think our members are able to do. There were also actually some misunderstandings just because it had been so long, and it had never been amended since it was brought in 2003. So sometimes an employer, and the most significant one is AHS, might have interpreted the scope of practice that's in the regs differently than the college had, or differently than even Alberta Health had. And so this is also an opportunity for us just to be more clear, so that everybody from the college to the employers to us as the ministry are all on the same page on what these folks are able to do.
So do we have any questions on the line? No? So it looks like we're all done. I think the speakers can stay, and I think one or two other LPNs might have sneaked into the room if anyone wants to grab an LPN on camera for a cutaway. But I think for the formal program, we're done, so thanks very much.
Great. Thanks, everyone.